Let me welcome all of you to the Milford Senior Center. This is a public forum about proposed public transportation in the town of Milford. My name is Brian Murray. I'm the chairman of the Milford Board of Selectmen. The individuals with me at the table, we have our state representative, John Fernandez, to my right. Next to him is Mark Shane. He's the chairman of the Finance Committee, Town of Milford. Over here we have Ed Carr. He is the administrator of the Metro West Regional Transportation Authority, MWRTA. And to his left is Carl Damigella, who also works with the MWRTA. I want to thank all of you for coming here tonight. We're looking for direction from you, the residents in Milford, to see if this is a proposal that makes sense for our town, that's a good thing, and what your thoughts are on it. So I'm going to start it off by asking Ed Carr to give us a little bit of an overview of what the MWRTA is. We'll have a couple of other speakers to give comments, and then after that we're going to open it up to you for questions, comments. I would ask that you keep it as brief as possible because we want to try to hear from as many people as we can. Our Senior Center Director is here, Sue Clark, and she has a microphone so that wherever you are, you can stand, she will come to you, and that microphone will be provided. We also have our Town Administrator, Rick Villani, here. If there's anything that you need, he's here to help facilitate things. And in addition, Harold Rhodes, who is the chairperson on the town's Commission on Disability, is here, and he's been a very, very important person in moving this project along. So with that, let me turn it over to Mr. Carr.
Thank you, Brian. So this is what I want to show you here, and I want to give you a little bit of the history of the Regional Transit Authority. Back in 2007, if you looked at a map of the Metro West area as a whole, there was a hole. There was a hole in the middle of it as far as public transportation went. The Framinghams, Natics, Marlboros, that whole area just north of here didn't have any public transportation, as well as Milford and you know, the surrounding towns, Bellingham, Hopedale. Nobody really had good or any public transportation other than the commuter rail, and you know, that was difficult to get to for a lot of people too. So anyway, make a long story short, in 2007, the legislative caucus from Metro West got together and, under the leadership of Senator Spilka, tried to get legislation changed to allow the communities in Metro West to create a regional transit authority where there was none. Now, a regional transit authority is a locally controlled entity. It's controlled by the municipalities that join it. They make the budgets and decide, you know, what's going to happen in the authority itself. They hire the administrator, they approve budgets, they set fares, and they also advocate for each of their communities as far as what kind of public transportation they want and can afford. Now, can't afford is a big item on the list of things to do to have one. Now, fortunately, for a lot of the communities back in 2007, 8, and 9 that joined the Regional Transit Authority, they were being assessed by the MBTA for service they really weren't getting, but they were being assessed by the MBTA to fund the MBTA. So when the law changed and the legislators got together and amended Chapter 161B and 161A, which is the statute that runs the MBTA, to allow them to credit the assessments that they were paying to the MBTA anyway to get service of their own. And also at the time, they were going to add some state contract assistance to go with it. So the long and the short of it is that these communities, it was pretty easy for these communities to get into it because it didn't cost them any more money, that they were already paying the money. It was just a diversion of what they were already paying to allow them to get into this regional transit authority. There were a couple of communities that they weren't being assessed this assessment at the time. Milford was one of them, and Hudson was another one. So the decision for them to join the Regional Transit Authority was a much harder decision, way harder, because now you're talking about, okay, if you want to get into it, it's going to cost you some money, and what do you want to do? Would you rather have, you know, a teacher, or would you rather have some public transportation? And so the decision, the other communities didn't have to make that decision. Milford did, Hudson did. So that's why it's taken so long for us to get to this point where, you know, the authority has grown, so maybe there's some benefits for Milford joining the Regional Transit Authority. And I would applaud Mr. Murray here for stepping forward in this last couple of years and allowing this to happen, because it is, in fact, the Board of Selectmen, the executive board of the municipality that makes that decision to lead their community into the Regional Transit Authority. Now, once you're in the Regional Transit Authority, that still doesn't mean it's going to cost you any money. It just gets you to the table. The money part, you know, we're still working that out, but, you know, with Representative Fernandez and some of the rest of the caucus, it looks like, you know, it's probably going to happen, and it's not going to be a huge burden on the taxpayers for the type of service you're going to get. So anyway, make a long story short, I've already made a short story long here, but this is our authority as it stands. So what we have here is there's a couple of loops in Framingham and Natick. When we started, they weren't even connected. But now the authority has like 12 routes. I mean, we have routes that go up to the Solomon Pond Mall in Marlboro. We also go to Woodland on the Green Line. So once you're into the system, and you can get into the system by just connecting to Holliston down here. I mean, you could virtually go to Paris without driving. But anyway, you could. I mean, that's the beauty of public transportation. You know, you could get up to Framingham, get on the Logan Express. There are a myriad of things that you can do once you're into the system. Okay, so you're so close now with Holliston having the system that it has, that it's almost, I would say, you know, I'm going to tell you it's a no-brainer anyway, because I'm a public transportation advocate. But you know, I hope that there's a lot of support in the community for Mr. Murray and what he's proposing here as far as finding out from you what you really want about public transportation. We're here to help. We have several maps. There's one over there right behind the representative, and there's a couple here with proposed routes. Now, we were given the names of places where destinations and that kind of thing. We don't have anything really written in concrete yet. We want to get some feedback from the public as to where you would like to see routes, where you want to go, and that kind of thing. So I'd like to introduce you to Carl Damigella. Before Carl speaks, I'd also like to tell you that Carl was a long-time selectman in Holliston. Long time. I mean, how long? Long, 15 years now. And since the Regional Transit Authority started, I mean, Carl was one of our original board members, and since he got off the board there, he's come to work for us. And he's a real public transportation advocate for the whole region, but specifically Holliston. And one of his dreams has been to connect with Milford. And why is that? Well, because there's a lot of people in Holliston that want to come to Milford. For all the good reasons you know about, and vice versa. One thing you should know too, before I give it to Carl on specific routes, one of the other benefits to being part of the system is you have one of the finest hospitals in the Commonwealth here in the Milford Hospital. But also, we connect with the Marlborough Hospital, the Framingham Union, the Leonard Morse, the Newton Wellesley. You know, this is, eventually, as we all age and we start depending on hospitals here, a lot of the hospitals are going to get specialized in things, and a lot of people are going to have a difficult time going to the different specialties of hospitals. But in this system, this opens up 5 hospitals to you. So there's just a good reason right there we wanted to have public transportation. So again, Carl's been working his head off on this thing so much so I probably have to give him tomorrow off. But I'm going to let him speak to you a little bit about the routes and what we're sort of proposing. But note that nothing is in concrete at this particular junction.
Thank you, Ed. We run a shuttle on Tuesdays, Wednesdays, and Thursdays from Framingham into the Boston Hospital the Boston hospitals in the Longwood area. So we go to the VA hospital in Jamaica Plain and West Roxbury, New England Baptist, Brigham and Women's, the Deaconess, Beth Israel, Jocelyn Clinic, the Children's Hospital, and also to Dana-Farber in Boston. We have a shuttle through Partners that runs from Brigham and Women's over to Mass General Hospital, and that cost is free of charge that Partners offers to get over there. So not only do you have the 5 hospitals that Ed was talking about, and we are eagerly waiting to get something going in Milford because of the fact that we have a lot of residents in Holliston and Ashland on the Route 6 that comes towards the Milford line. We actually come into Milford in the morning early and in the afternoon, and that's for people that are taking the buses out of Milford and for rides to work in Framingham. So we have a lot of people that are riding that bus now. So when somebody says, does Milford have public transportation? You really don't, but you really do. So it's only those 2 routes during the day that bring you either in or out of Milford. But we are providing something now. And by providing a fixed route within the town of Milford is going to provide you, as Ed said, to connect into our system, which can take you virtually anywhere in the world. My comment used to be when I was trying to advocate for Milford to join the MWRTA when we first formed was that you could go any place in the world, and this is no offense to the town, except for the town of Milford. And we'd like to erase that and have it so that you can go to the town of Milford. You have to understand sort of the mindset of the people in Ashland and Holliston. And the reason I say Ashland and Holliston, both of those towns are right on the Route 6 that comes up to Mission Springs in Holliston, which is about 1.5 miles from the Milford town line. And the thing is that those people in those towns would rather come to Milford to do their shopping at Target and Best Buy and Staples and Bed Bath & Beyond and all of the other box stores that you offer within this town than to go over to Framingham shopping, because they don't want to handle the traffic on Route 9 and Route 30. It makes more sense for us to come to Milford because it's easier for us. And the reason I say us is because I live in the town of Holliston, but for the last 1.5 months working on this project, I was thinking about moving to Milford because I spent more time here than in Holliston. So, as far as the turn-by-turns are concerned, that if everybody got this piece of paper with all the turn-by-turns and the maps that are up here as to where the proposed sort of example of what we'd try to do to start the process. And this is not etched in stone, as Ed said, because of the fact that if this is something that Milford wants to move forward on, it wouldn't be able to, at the very earliest, take place until the money was appropriated and be able to be spent after July 1st, when you start your new fiscal year. So there's a long time, and this is going to be a long process for us to go through. So that if somebody says, well, gee, that's nice, everybody over on Shadowbrook's gonna have the opportunity to take the bus, but I'm over on wherever it might be, and you're not coming close to me. So that's some of the fine tuning we would have to do. And what we did was we received a recommendation list of places that were most important as far as the density of population. Because we're really not running a taxi service, we're running public transportation. So what we want to do is if we can get within 3/4 of a mile to your house, we feel that people will walk 3/4 of a mile. I mean, on the other routes that we have now, people are doing that. Because the demographics of a town is sometimes from one end of the spectrum to the other end of the spectrum as far as whether there's a 2-car family, a 1-car family, or a no-car family. And that's what we're trying to service. We're trying to service those people, not only that have 2 cars, because we have a bus route that runs in Wellesley, and when we started doing the Wellesley run, I was one of the doubting Thomases to say, I don't see where anybody in Wellesley is going to use a bus. And they do. A lot of people do. We built up quite a route in the town of Wellesley, so it's very important that people look at it that, you know, I'd like to be able to go to work, or I'd like to be able to come to the senior center. I mean, we have 2 times during the route that I set up that we're coming to the senior center. So if seniors want to come and go during the day, they can do that. We've hit most of the shopping centers as far as the Stop and Shops and the Shaws and Hannaford's. And we've hit that so that if you get picked up and you get dropped off there, within an hour it's going to be coming around again to pick you up and take you back to your home. So that's why I'm saying that, you know, you might say that this is only favoring the people that are living here and there, but that's what we need to hear from people too, is to where would you like to see the buses go? As I said to Mr. Murray, I said, you know, we took the input from the selectmen, from Harold, from Town Administrator LaValle, and the main things that we looked at was that we hit all of the prospective areas that they were looking for. But we don't know if there's someplace else. It was the same as all the medical centers. The Milford Regional Medical Center, we've got Dana-Farber. We got a lot of people in these other communities too that would rather come to the Dana-Farber facility here in Milford than worry about going into Boston. It just makes sense as to what Milford is beginning to develop into and what you are able to offer for resources within this town, that there are people in the surrounding towns that want to get here. They don't want to go from here to Framingham because you have a hospital, from my understanding, I've seen the banner on the building itself, it says the top 100 medical facility in the country. And it's true. Back in the early 70s, I was on the Holliston ambulance. And we used to have to call ahead to tell Milford Hospital that we were coming to the emergency room because there was never anybody in attendance in the emergency room. Now, I would rather come to Milford Hospital than any other hospital that we've listed here today. I'm going to say that I ran into a very serious heart problem, and Dr. William Shine, who's up here at the Milford facility, I credit him to saving my life by having to put in stents where I had arteries that were blocked. But, you know, it used to be where you didn't want to go to Milford. Now there are some facilities that you don't want to go to in other towns, and I'm not cutting down those medical facilities because I think they all have great facilities and options for you in the medical field. But you have to look at this as, you know, there's probably the doubting Thomases in the room that are going to say, I would probably never use public transportation. One of my roles at the Metro West Regional Transit Authority is I am a travel trainer. And I go to a lot of senior facilities, and we get people to how to ride the bus. And it works out very, very well, and I'll tell you why, is because I always hear it when I first start talking at a senior center is, I still have my license, I don't need to worry about riding on the bus. I have seen people in their 40s and 50s that have had to give up their license because of medical reasons. We also work closely with the Department of Transportation, Registry of Motor Vehicles, with a young lady that works with us in how to transition the elderly when they have to have their license taken away. And it's devastating. You might as well cut their leg off than take their license away. And it's very devastating to a lot of these people. But if we can keep their independence by showing them how to ride the fixed routes of our buses, then they don't feel as bad losing their license. I had a 50-year-old lady from Natick that I took on a bus adventure once that lost her license because she had a stroke, and her doctor took her license away from her. So the reasons that we all think we're going to lose our license because it's the fourth DUI, that's not the case. There are other reasons too that you're going to lose your license, and we want to be able to maintain that independence.
I want to open it up to everybody here as soon as possible. Before we do, I'd just like to have a state representative say a few words for everyone.
Actually, I want to thank you all for coming out. This is a really tremendous cross-section of people. When I met with Father Mac last weekend or the weekend before about this event, and we were talking about what kind of turnout there'd be, and well, I guess we found out a really great one. Public transportation is a priority for me. It has been, as long as I've been in the legislature, but it really roots in my family. My mom was one of those folks who never drove a car, never got a license. So her ability to get around through her 83 years of life was dependent on people like Fran Small and Brian Murray. And the line she used to love to deliver was, well, you know, my son's a very busy attorney, so as she would call Brian and Fran. So
Absolutely true.
It's a 100% true line she delivered. But it's the kind of thing that people who, having no car and having no license can be incredibly isolating. And that's what I learned through my mother's life, and it's what informs me and drives me to be a part of this, to do what I can to be helpful. So I'm grateful that you're here. I know what the selectmen and the town officials want to do is hear from you, and that's what I want to do. My role here is to try and partner up with them and do what I can with the Regional Transit Authority to be helpful on this. You should understand, to what Ed was saying, our goal is to have public transportation that links the state from east to west, north to south, diagonally across, so that at one point or another, I'm not saying it's going to be fast, but by one point or another, you can get anywhere in the state that you want to go, and we're going to continue to do that. And I wanted to mention that Mark Reel is here, who's the constituent director or district director for all of that, for Senator Fatman, who is also a partner in this effort. So I wanted to mention that he's here, and I see that Will came in up back and should come up front and take part in all of this. But thank you very much.
Thank you.
Thank you, John. Yes, my colleague on the Board of Selectmen, Will Kincaid, just arrived. So, Will, why don't you come on down here? In case anyone doesn't know, Will works for the MBTA, so I think he's got a little bit of a vested interest in public transportation. Okay, I'm going to open it up now to questions, and just, put up your hand. I'll recognize you, do the best I can. And like I said, Sue Clark has a microphone to go around so that everyone can hear what it is. So it can be a question, a comment, and we see this individual's got his hand up, or just stretching? No? Yeah.
I'm legally blind, but I was legally reliant on my bumps. Great, I get the bus. So I from Boston area, I want to go see.
Thank you. Thank you. And just a reminder, if anyone has not signed up, we have sign-up sheets here. Please make sure you do so, because we really would like to have an accurate record of how many people came. Ma'am, in the white shirt?
Thank you. I have two comments or a question. First is I noticed on the map you cut a spur to Memorial Hall, and that really is a good resource when people go to the library, to the schools, and to the town park. I don't think it would make too much time to continue to go to Memorial Hall and then back down past the town hall and then down both the way that it lists. The other thing is, I don't think anyone has mentioned how often the buses would run, what the time frame is.
That's a very good point. Let me turn that over to Ed or Carl. With a reasonable time frame as to what the stops are.
Right now, if you take a look at those route maps that we have spread out, there's one there, and there's one hallway. That whole route, as proposed, takes about an hour and 10 minutes. We think, it's driven by traffic, and there's a lot of variables to it. As far as that variance that you were saying, I don't really know the routes as well as Carl does. Can you answer those questions?
Yeah, for those of you who have the, and I'm sorry to cable, and I'm probably too far from your microphone, but if you look at your turn-by-turn sheet here, this was this past Sunday. I started at the Temple Beth Torah in Holliston, because we're looking for a transfer route where the Holliston bus would meet up with the Milford bus. So this is just a sort of a temporary place that we would do this. I was talking to the rabbi at the Temple Beth Torah this morning, and there are still some issues that we need to work out with him. But we do have an alternate plan. So if you look at that, it says the time, and the start time was 1:55 in the afternoon. Now, I know on a Sunday, traffic isn't as heavy as it is during the week, but at least it gave me some sort of an idea for a time availability for that time of day. And it goes, I got back to the Temple Beth Torah at 3:03 in the afternoon. So it's roughly an hour and 10 minutes that loop takes. And it could, depending on fine tuning, it can be cut down, or would have to do something to sort of eliminate one area and maybe pick up an area, just like this young lady said about the library. Again, some of these stops, the Milford Town Hall to the library is less than 3/4 of a mile. So people would have to, if they'd rather have it go closer to the town park or the library, then we need to adjust somewhere else.
My name is Francisco Ramos. I'm a resident of Milford. I work for a not-for-profit organization in Boston called Healthcare for All. And, as part of my work with Healthcare for All, I've been meeting with a whole coalition of healthcare provider organizations that is called the Shena 6. I'm also sitting with the Milford Humanitarian Aid Coalition, which is meeting at Trinity Episcopal Church in Father Man. But first of all, I would like to commend you for this plan. It connects most of the health provider organizations and human service organizations. So it's a very, very good plan. But I think the question that is in everybody's mind is how many times a day will this bus run? For those of us like me, and Representative Fernandez knows that I've been saying this for a long time. I would like to not drive my car to Framingham every day to take the commuter rail. I would rather take the bus from here, and I can do that in the morning. I can take the 6:30 a.m. bus, but I have no way to come back. The only bus that comes back from Framingham leaves Framingham at 4:30. I leave my office at 5. So there's got to be a bus that runs around 6:30 somewhere to enable people to connect from Boston all the way to here. And so I guess the question is how many times this bus will run, and what is the plan for that? Thank you.
The proposal on the table right now is approximately 13 hours a day. So that would mean approximately 12 or 13 loops through Milford that connect to Holliston, which is pretty robust service. Whether that's gonna come to fruition or not, I don't know, but that's what we're proposing to do, which is, you know, pretty much what the rest of the system is. It runs about 13 hours a day, approximately 13 and a half. How many days? Oh, that's a good, very good question. 5 days. We have limited service even on our routes on Saturday, and we don't have any Sunday service. We're a brand-new regional transit authority with a youngster on the block, and when we talk about funding for our regional transit authority as a whole, there are 14 other mouths to feed at the table, and we're the last one there. We're growing our system. We know that the frequency of what we do it's okay, it's not good, and it's far from great, but eventually it will be. Eventually we'll get the funding, eventually we'll increase the frequency. But the metric that I'm faced with every day is fannies and seats. That's what I'm judged on. What is the ridership gonna be? If the ridership is there, I can go to the funders and say, look you know, my buses are chockety block full. We need more frequency on this thing, and I'm liable to get it. So you take the baby steps. And the thing about public transportation is, a lot of people think, geez, you put a route out there and it's gonna be chockety block full every day. That's not the way it works. You build public transportation one rider at a time. Well, I see Nancy Hanley sitting over here. She was one of my very first customers. And she gave it to me too about how the service stunk, you know? And I listened to Nancy for many, many years and tried to improve the system, but it's one rider at a time. If you lose that rider's not coming back, because public transportation is a personal investment too. You know, once you start using it, if it screws you, you're not gonna use it again. And a very good example of that is what happened last winter on the MBTA, right? There were a lot of people that were irked, and they lost a lot of ridership because of it. So, I don't know if that answered the question.
Because the last speaker referenced Father Mac Murray, and I know he's here, would you like to comment?
Sure. No relation.
No relation, that's right.
Other than your office is close to mine.
Just
Right.
close to God,
We're both close to God. There you go. How do I start this? Just about 10 years ago, I came to Milford, so I'm a fairly new resident to Milford. But I also came out of an area where we had mass transit every place, down in Virginia, and we're all county-based there, so it's not town-based, so it's a whole lot different than the way we run things. But when I got here, one of the things we were looking at is what are the needs of the community? And out of that, we formed something called the Milford Area Humanitarian Coalition, which has now been meeting for several years. And that group has basically 4 major thrust areas, one of which was transportation. And Harold came to us early on, and the town was just really wonderful in appointing Harold at that time to the MWRTA board. I had actually been to a board meeting back in 2012 when I went with John and our previous town administrator to look at what are the possibilities for Milford. And out of that, we continued to push, and Harold did a good job of going around and doing a lot of polling, and then wonderfully Brian took on the role of being our representative to the board. And we're getting where we are, and which is to hear from us. And it's really wonderful that everybody showed up tonight, because without the support of the community, obviously the finance board and the selectmen are going to say, well, you know, really? So thank you all for being here, first off. And then when we looked at what are the needs, I mean, I spent time, which was with our friends from SMOC, going and visiting with all of the folks that live in shelter in the Milford area. Probably many of us don't know that there's over 30 apartments that are spread throughout Milford. And a lot of people don't have transportation. And tonight, up at the church, as we do at the end of every month, we had about 100 folks show up for dinner, most of whom walked to the church because they don't have cars. And the idea of being able to get, as was mentioned, to Paris from here, when you can't get to the hospital right now, is a challenge. And so our focus in looking at this whole humanitarian aid and the needs in the area is how do we meet that need? And we're praying that this will continue to be a priority for the town. I know we've got other opportunities that are coming along to help make some of the funding realities happen. But you know, right now it's up to us to say, yeah, this is something we need. So that's my story, and I know that there's a few other folks that wanted to share a little bit about what's happening. And I think I mentioned Smock, and maybe Leslie, you want to say a word or two?
Hi, my name is Leslie Lee, and as Father Max said, I work for SMOC, Southern Middlesex Opportunity Council. We have 129 shelter units in Framingham, Worcester, Milford, and Marlborough. Framingham has transportation, Worcester has transportation, and we love Milford. A lot of the case managers, our health advocate came tonight, our secure jobs person came tonight, because we love Milford and we're trying to help the families that come here to our program to get jobs, to go forward. And I have two people here with me tonight that would like to speak, and I just would like to say, you know, these families desire to be part of the community, to work, to be a part. And you know, they can't even get to the grocery store sometimes when there's snow or it's cold out, or they have a couple of kids that they have to take in strollers. So I just wanted to say that I think it's wonderful. I really hope that everyone's on board for it, because I think this will make a huge difference. But more than myself speaking, I think that the two people right here could say more about this.
Hi, my name is Marcia Macri, and I live in one of the shelters. And I guess we all know wherever transportation goes, the town grows. And I'm a Worcester State student, and I have no clue. I just lost my car. Still have my license, but I just lost my car. I have no clue how I'm gonna get to Worcester State. And the grocery, I saw that one of the plans was to get to Hanford, because the grocery walk so far has been very, very hard. It's like you go 3 times in the grocery to do one trip if you had a car. So I do feel like my legs got cut off. But I think that will be a great opportunity for Milford, not just for us, but for Milford itself to grow. With a great hospital that they just opened, I think great opportunities. It would be much easier and less crowded to reach this hospital than it will be for Boston.
Thank you everyone for coming. I'm Frederick Chigundu. I'm also part of the people in shelter. I was living here in Milford, and then I was transferred to Framingham in shelter, but I'm gonna be coming back. Actually, I was excited when I was looking at the sheet that because I'm gonna be living in Groves, the shuttle may be going through the direction, which is a plus for me. But going back to the transportation, I'm so excited about this because, yes, I know these are baby steps. At first, I thought they were going to improve connecting between Milford, Holliston, and Framingham. But looking at the sheet, it's like there's going to be provision within Milford, which makes a lot of help, especially for my case. As a husband, I have 2 kids and a wife. Definitely I have to be on my feet, which means I have to get a job. we got a car, but my wife, since she has a kid, she has to be having the car. So it will give me an opportunity to rely on public transportation and also improve my financial status. Right now, actually, I'm training with MWRTA to be a van driver. And I was thinking if I provide services to other communities, let's say Framingham, Harleston, and it's not here in my hometown, it would be like a disservice to me as a person. But with this proposal, I would serve when I know even my community is being reached. Yeah, thank you.
Thank you. I'd just like to mention before I call on anyone else, the Milford Regional Medical Center has been a very key player in bringing this process to where it's at right now. And I know Ellen is here, and I'd just like to have her come up, or if there's anyone else representing the hospital.
Hi, everyone. Thank you all for coming. My name is Ellen Friedman. I'm the manager of community benefits at Milford Regional, and I also chair the Chenam 6, which Francisco mentioned a moment ago. But thank you for inviting me. I'm excited about commuting from Holliston. I might be your first person commuting to work. So someone's got to ride the bus first, right? Someone has to be first. I'll volunteer. I am sorry that our CEO and president just had to leave. He's on a cable program tonight. So Ed Kelly was here, as well as Phil Sarah-McCauley, who's the president of the Tri-County Medical Association. So both of those gentlemen were here earlier, so they don't get to hear my speech. But what I really wanted to do is just speak a little more specifically about the medical needs and really reaching medical appointments and accessing medical care. And we talk about medical needs in a broad spectrum, but I'm really going to focus on just getting to your medical appointments, which is so crucial. And yes, thank you for the kudos for the new hospital building, but we do have already just a huge need, even before we expanded or created more of a need. So there's just want to give you some information. There's about 15,000 visits a month at the hospital, ambulatory care visits, and 60%, that's the 60%, that is 60% of the visits, and they're all from Milford. So there's a lot more, 26,000 a month, but the 60% is from Milford only. Also, our hospital partners at Dana-Farber, they see about 1,500 patients a month, and many of these patients come multiple times during the week, and they will say that transportation is their #1 barrier to getting people to keep their appointments. People are often told not to drive to their appointments, so again, they're looking for rides, but they're also having to look for rides frequently, which is difficult, particularly if any of you have been in that situation. You really know what I'm talking about. We have 11 sites, Tri-County Medical Association sites in Milford, and so many of these stops are maybe not in front of the medical facility, but are very close, so you could get to your medical appointment in Milford on this proposed route, which would be tremendous. So that's across the whole town. That's about 30,000 visits every month. And then we're looking at the health center. Kennedy Health Center has about 600 visits a month. 71% of those are Milford residents. So it's a huge need there. I talked a little bit about myself commuting, but there are 300 employees at Milford Regional who also live in Milford, and so people could commute to work. And also this would connect people from other towns coming here who would also be able to commute to work. And this would expand if they worked at any other medical site, if they worked at any care facility in the community. You could get your employees, your help to work in a reliable way, which is important. And you did refer to that about getting yourself to work to really improve your financial status, to actually have employment that you can rely on. So all of these are some of the many benefits. There's a lot more. We meet as a coalition with Chenam and have talked about a lot of the additional needs in the community, because this is a quality of life issue. It's definitely an issue that is important for lots of for medical needs, but it is also a quality of life issue. So I'm looking forward to hearing more comments from people and answer any questions. But I do think together this is something that really will enhance not just our health care, but our overall care, our overall health. Thank you.
And lastly, the Milford Chamber of Commerce has been very, very supportive of this proposal. And David Price, the president, is here. I could ask him to say a few words.
Thank Good evening, everybody, and thank you for the opportunity to be here. This is a wonderful event. I'm glad to see everybody turn out, and thanks to all who have helped to organize it and for the Senior Center for hosting us here. I'm Dave Price. I'm president and owner of Bright Star Care, which is a home care and medical staffing company. I'm also the outgoing chairman of the board for the Chamber of Commerce. Siobhan, who's our president, had a death in the family. She can't be here tonight. She wishes she was, but I'm happy and honored to represent the chamber here. At the last meeting I attended on this in December at Town Hall, we announced that we would be conducting a survey of the chamber member businesses to see their opinion of the public transportation proposal, and the data is very fresh. It's been reviewed by the chamber board, and I'm happy to share what some of that data is and what the chamber's position. So in the interest of time, I'll go relatively quickly. So first of all, who did we survey? We surveyed, we sent the email survey out to all the chamber member businesses. So any business that was a member of the Chamber of Commerce, whether they're in Milford or outside of Milford, received the email. It's about 785 companies. We had a response rate that I thought was a little low, and I'll comment on that, but of the respondents, 60% of the businesses were in Milford and 40% were outside of Milford, and of those within Milford, half were either downtown or Fortune Boulevard area. The other half were kind of evenly distributed elsewhere in Milford. And the size of the companies was very reflective of the chambers. 2/3 of the businesses who replied had 50 employees or less, and 35% had 10 employees or less. So we're talking about some pretty small businesses where every dollar really, really matters. And annual revenue ranged from $100,000 to over $5 million, fairly evenly over that range. So what did they say? We tried to keep the survey simple and really asked two major questions. Do you think this proposal will have an impact, a positive impact on your business, no impact on your business, or a negative impact on your business? And the first question was relative to revenue. Would it increase your revenue or have a positive impact on your revenue? Would it not, or would it be negative? And 53% of the respondents said it would have a positive impact on the business revenue, and 58% of the Milford-based businesses said it would. So over half of the respondents said that this would have a positive impact, and I think that's echoing a lot of the comments that I heard here tonight. Second was related to employment. Do you think this proposal would have a positive impact on your employment? No impact or negative impact. And again, 37% said that it would have a positive impact, and of the Milford businesses, 50%. So there's a perception of the Milford businesses, they could hire more people within, from the Milford community with this. What's important in both questions, 0 people said that there would be a negative impact. And there's been other issues that have come through the town where the town's businesses have been divided. This is very, very clearly aligned that either folks thought no impact or positive. No one had a negative thought. So just a couple quick comments on the chamber's position, and we'll probably, once we have the time to digest this a bit more, put a more formal statement together. And also this survey was done before we saw these routes. So this was a fairly, does this concept make sense to you guys or not? And you heard what I said. So the chamber's position is that, the response rate's low. It's not out of line with other surveys, and as more detail comes out now, we would expect in the next surveys we would get an even higher percentage. And we stated in December that any project that would have a positive impact on employment and a positive impact on businesses would be something the chamber would get behind. And given that it's so overwhelmingly yes, it would be no harm, or yes, it's going to be positive, that the chamber strongly supports this project. We look forward to learning more details about the proposals as they come through, and we'll continue to stay engaged and monitor the member businesses. So that's a summary. Thank you.
Thank you very much, David. And if you can get that survey results to the Board of Selectmen, and if you'd like to come back at any time to talk to us about it, we'd love to have you back.
We haven't even reviewed it at a formal board meeting, but once we do, we'll get something together.
Great, thank you.
I have a question. I live in my own apartment in Milford, and I have to walk all the time because I go to cross Holdale, and it's from a walking distance, and other places are too, because I don't have a car. And like, I'm sure, like, from the buses that go in Milford, I wonder if, like, there will be other bus routes, like in Upton, or probably Franklin, or probably in Hopedale, because I go to Crossroads, and if they will be available also in those certain areas.
Are there ways to connect to those other communities, Ed? Is there other transportation systems?
I couldn't give you the answer to that right now, because those communities are not members of the of the Metro West Regional Transit Authority. I believe, though, Franklin belongs to GATRA, Greater Attleboro. You know, we every day we're faced with the boundary issue, and it's something that we do want to connect the regional transit authorities. It's coming, but, you know, again, we have to establish these routes in a very clear way first before we can expand. So, yeah, we want to do that, but it's not happening tomorrow.
Yeah.
I used to take the premium bus off and on for a number of years. So I was wondering what the prices would be for buses.
Yeah, very good question.
Fares?
Yes.
Yeah,
Fares.
they're going to stay the same. There's what they are currently. It's $1.50 for an adult fare. It's $1 for a student. It's 75 cents for a senior. If you use the Charlie cards, you get a discount, so that the fare winds up being $1.25 and like that. And I dare say over 60% of our riders use Charlie cards.
Is it available at the town hall?
Charlie cards, they're available on the bus. Your bus driver will have blank Charlie cards, and you can actually load them on the bus, on the fare box.
Yeah, will the Milford residents be able to get them at the
You'll be able to get them right on the bus.
Not a question, just a comment. I'm just concerned about crosswalks and pedestrian access where these stops are. Some of them seem to be in a rather dangerous location.
That cogent, comment, and some we're definitely going to be looking at, and that's why none of this is written in concrete. One of the most important mantras that we have here is safety. Our drivers are trained to, in fact, just so you know, in the system that we have what's called a flag down system. So there are stops, yes, but we'll pick people up along the route because it's a flag down thing, but we'll only pick you up in safe places. The bus won't stop in the middle of a place that's not safe to pick you up. And so what's happened over the last 7 years is we've developed stops. When we first started, we didn't have any stops. We were all flagged down, and the people were the ones that created the stops, because everybody finally, hey, geez, this is the safe place. So instead of picking up 10 people in 100 yards, they all got together in the safest place. And that just comes with time. That comes with, people figure out where's the best place for the bus to stop, and the drivers are trained not to stop in places that aren't safe.
Yeah, and just keep in mind, the proposed route is a rough skeleton right now. So if we get the sense that those are the areas that we might want to stop, it's going to be further detailed and pinpointed through our town engineer, our town planner, police department, to get to that level of detail. But we're not at that level of detail yet. We're just trying to generalize where we're looking at.
Hello, my name is Hadassah Rose. I'm the owner and director of the Women and Children's Homeless Shelter located here in Milford. I get a lot of our families from SMART. Hi. And from the hospital. One of the biggest problems we have with the women that are staying in the shelter is they can't get to work, but they're losing their jobs because they can't get to work on the weekends. So even if you had a service that picked them up in the mornings and brought them back in the evenings, at least they would be able to keep their jobs, because their jobs are located oftentimes in Nate, at the mall, and places like that.
As I said earlier, we don't have weekend service. We have a limited service on Saturday. We have none on Sunday, which, again, really irks me, I go to church every Sunday, and I just assume everybody else wants to go to church on Sunday. There are people who can't get there, and it's ludicrous to me that there is no service on Sunday. But to address your specific problem, we do work with SMOC in Framingham, and we've already provided them with a couple of vans that they're working with families now, and I would encourage you to call up Mr. Cuddy and Mr. Desolitz and just say, hey, what about Milford? Can we get on the, and they're in a position where, if we give them capital, which is, we've given them recycled vans too already, and they put them to great use. So maybe, there's a way where you guys can help yourselves through us and SMOC. You're welcome.
My name is Mike Visconti, longtime resident of Milford, and I'm wondering if you could talk a little bit about what the yearly cost to the town might be.
Yeah, no, that's a great point. Right now, we have a proposed budget of about $250,000. Where if we take steps beyond this particular point, it's going to be to see what we can do to try to drive that figure down in terms of negotiations with the RTA, grant applications, and also assistance at the state level through our representative and our senator.
Is that yearly?
Yes.
So it's not higher as an initial investment?
No, that's a yearly proposed budget figure right now. Operational cost.
Of the fares before, would you have discounts for veterans and also handicap with the access card?
Active duty veterans, if you're in uniform, you ride for free. Disabled veterans or anybody with a disability, it's you have Charlie card, disabled Charlie cards. That's about half price. I think it's like 75 cents. People who are visually impaired and have cards from the Commission for the Blind ride for nothing.
Hi, I'm David Gafford, a 15-year resident of Milford. I have a question regarding the economic boom this is supposed to bring in. Specifically, it's been mentioned that for healthcare in the hospital, that they would derive a great benefit from this. So my question is, what is the hospital going to do to try to offset some of these costs for the taxpayers if they're benefiting greatly from this? Is there something that the business community is going to do to help offset the cost of the taxpayer?
Absolutely, and that's one of the major grant sources that we're going to be looking towards. It would be a significant portion of that budget if we're successful with that grant opportunity.
Is the grant a one-time thing or an annually recurring?
We haven't even started yet. Yeah, it's initially it would be for a per year basis, and my understanding is it would run for a period of 3 years.
Hi, I'm Diane Canino, and I arrived in Milford because there was a job in Milford. I lived in Watertown. I didn't know that Milford existed. Prior to that, I worked in Boston, Cambridge. I worked for, oh, by the way, the job was up on Beaver, and it was a business job, okay? And I was willing to commute. I've stayed in Milford because I love it. I'm now retired. I volunteer. I still have to work part-time, and I'm 70 years old to pay for my condo. Recently, I had very minor issues regarding health, God bless. And I found it was very difficult when I had an appointment and they wouldn't allow me to go to the hospital until I had a ride. So you're looking at a base that has worked with special communities with transportation needs. I work in marketing now. I know Milford a little bit in terms of business. And I'm also speaking from my own point of view. I do not have sources for rides. When I can no longer pay my condo I am going to have to move out of Milford because I can't get to the places I need, including grocery shopping. So I'm trying to help us all to really take a good look at the economics. I'm also so proud to live here because Milford has one of the best financial positions as a town in the whole state. So stay with us.
Thank you.
My name is Carl Damigella, and I work at the WMRTA Health Center. We've been here in Milford for almost 2 years, it's going to be 2 years in March, and work at the Social Services Department. I've been dealing with a lot of problems, patients who can't come to their appointments because of a lack of transportation. And I truly believe that public transportation comes to Milford, it's a matter of public health. We have thousands of patients who are Milford residents, and speaking with them for the past 2 weeks, they asked me to speak on their behalf because they couldn't come here because they don't have a car or there's no public transportation to bring them from their house to the senior center. And I hope that we can bring the public transportation to Milford. We can decrease the number of no-shows so people can get access to their health, and they can be again on track of their own health. So I hope that speak on their behalf, you guys can study the possibility to have public transportation in Milford. So thank you so much.
Thank you for your comment. Yes.
Hi, my name is Stephen DeHakins, and I am the director of the Milford Youth Center. I think that this proposal is great because it will allow some of the kids that come to the youth center to have transportation there. And also, one of my biggest questions at the youth center is, how does my kid get from the other side of town to the youth center? And my answer is, well, the buddy system for now. So this proposal would be great. Thank you.
That's great. Thank you.
I'm Amy Leone from the Juvenile Advocacy Group, and I have a mental health practice in Milford, and I think that transportation would be wonderful to get, just as Sydney said, working with a lot of kids from the youth center to and from appointments for mental health and also for substance abuse issues. But the one question I do have is where the stop is for the town hall. Is it possible to have it on the other side of the street just for the kids crossing to get to the youth center? Because it looks like it's near the town hall, near North Bow Street. That would be my only concern.
Yeah, again, as I said earlier, really what we have right now is a skeletal framework, and if we think that that particular stop makes sense, it will get a further level of detail to get to the kind of issues that you're talking about. It might make more sense on that side of the street, on that side of the street, over there, whatever. But I think the big question at this point is, do we want to stop in that general area? You know, so right now it's kind of a general type time frame, or locations rather, I'm sorry.
Hi, my name is Maria Bradley. I'm one of the case managers that works at SMART, that works in Milford as well as Framingham. I'm also a resident in the Hopedale community. I'd like to make a comment. First of all, I'd like to say I echo a lot of what's being said here today, and I'd like to reiterate by saying that bringing transportation not only helps the community for businesses and increasing businesses and people getting back and forth to work, but it also helps those of us that have young children that go off to college to be able to come back and visit us without going out of our way to visit them, and other family members that live outside of the community to visit us. Now my question is, how late would this transportation be running? Because we do have clients that do their shopping, come back from work, and utilize the food pantry and are unable to carry some of these things home. So how late would this be running at night?
Yeah, time frame.
Generally around 8 o'clock. Sometimes it could go as far as 9, but that's kind of the time frame we're in. As I said before, our problem with the Regional Transit Authority is frequency. We need more frequency. We're half built, And as we build more, we'll be able to, go, say, have some trips later at night. Particularly in the job areas, that people, they get out of work at 10 o'clock, there's no service. So right now, 8 o'clock, from 6:30 in the morning, sometimes earlier, but we run approximately 13 and a half hours of service, and that can flex a little bit.
Hi, I'm Gerard. I work at the Milford Library, so a lot of what people have already said was not news to me. I think people of all ages would benefit from a bus service. I'd also like to say I've worked at the library 17 years, but I've lived in the town. It'll be 20 years this year. And one of the things that's great about Milford is Milford doesn't spend money crazily. Milford always does its homework when it's considering something, and so much homework has been done. We're so close. A lot of the details will be worked out. The route that's up there now, I'm sure will look different in 2 years' time, 3 years' time. But we really should seize this opportunity to make it happen as soon as possible. And then, get the routes going, see what needs to be fixed, based on feedback. And it's just a terrific time to be living in Milford. I'd also like to say, in terms of the schedule, the proposed stops, I did see that Coles was on there and Cornerstone Assisted Living Facility. That's really close to Birch Street in the Bear Hill Business District. There might be a lot of employees that work in those businesses as well. Thank you.
Yeah. Thank you.
My name is Julian, and we should have public transportation because if you live more and if someone wants to get the pins, should my mom do?
Yes.
Duly noted, Julian. Always heard. Thank you for coming here, Julian.
First of all, are you planning on trip to Paris? I am a resident in Mount Court. I'm very familiar with a lot of the residents there, and this area really thrilled you guys bring this possibility. I was curious about, as far as you guys talking about connecting to Holliston. Now, would you talking about like a transfer or an additional fee? How would that work?
That's a very good question. We're not quite sure yet. We're going to see how this route works out. There's two ways to do this, and we're still thinking about what would be the best way. One way would be to have the route in Milford just keep doing Milford every hour and 10 minutes. It would come to that place where we would propose a transfer. Or the other way to do it would be to have two buses, one leaving Framingham, doing its regular route through Holliston, but keep on going to Milford, do the Milford route, and then come all the way back to Framingham, so that when the bus leaves Milford, another bus is right there to go into Milford. See what I'm saying?
Sure, sure.
So there is no transfer, it would be a one-seat ride. We're looking at that too, but again, that's all about timing and coordination, and there's a lot of things that go into something like that. But that would answer your question as far as, and where the transfer point is, that's another question, but we're working on it.
To your point, Dr. Shine is actually not in Milford. So you'd be passing over two town lines of different jurisdiction for the Metro West Regional Transit Authority. I believe that, I'm not sure if Oakdale even belongs to an RTA, and I don't think Mendon does either. But, it would be something that maybe in the future, if those towns decide to join the Metro West Regional Transit Authority, then they could do what Milford's doing now in order to sort of combine a route that would go into those towns. I appreciate your thoughts very much, because there's probably going to be a day I go to Dr. Shine at least twice a year. It would be nice if I didn't have to worry about driving or something. The way that the turn-by-turns and the route right now, as everybody has said, this is not etched in stone, but we went as far as the courthouse and made that the turnaround point. We have to make a transition someplace to start coming back so that we can go what's called inbound. Anything towards Framingham is inbound. Anything away from Framingham is outbound. Think of it as a wagon wheel, and the hub is the center of the wagon wheel, and that's what we are, we're the hub. And we have the branches of the different routes that come out, and if you go towards the hub, it's inbound, away from the hub, it's outbound.
This is a wonderful opportunity for all of us tonight. What can we do as citizens to make this happen?
That's a very good question. I think if you think that this is a good proposal, I would suggest that you get more involved. We'll be bringing it up again at our Board of Selectmen meeting. If the board feels that the proposal ought to go forward, then it's going to go through the town process, work with the Finance Committee, and ultimately go before the town meeting. And there's a town meeting scheduled in May. Even though you might not be a town meeting member, if you live in Milford, you can address the town meeting. You could contact town meeting members and tell them your thoughts on it. You know, anything, if there is something specific you might want to get involved with, give your name to our town administrator at the selectman's office, and we can be in contact with you and see what you can do for us. Yeah.
Hi, my name is Dennis Rice. I'm the Executive Director of Alternatives. We are a nonprofit that provides residential and employment services actually throughout central Massachusetts to over 1,500 adults with disability. In Milford, we have approximately 45 people that Alternatives serves, many of whom are here tonight. And they would definitely use on a regular basis the transportation. These individuals are on a fixed income. None have cars, and they have various needs. They would certainly use public transportation for grocery shopping, going to the bank, going to the library, just doing a whole variety of things, including medical appointments. Right now, all of their transportation needs are through our alternative staff, which then takes staff away from the very important work that they do in teaching them critical skills and developing them supports so they can become contributing members of our society. So public transportation will be a huge step in their journey to independence by developing a real home, by getting a real job that the Chamber President talked about, and developing real friendships in the town of Milford. So we're very much in support of this initiative.
That is well said, sir. I actually sit on the board of directors of the Center for Independent Living, the Metro West Center for Independent Living, and one of the challenges that we face in the disability community is the unemployment rate is 70%, 70. And these are people with a slight accommodation could be productive workers in the society, and not only productive, they want to work. These folks really want to work. We have a call center in Framingham where we have 5 people who are visually impaired, and the Commission for the Blind has supplied us with the accommodations for these folks to work. And they're some of our best employees. So I applaud what you said, but just to add to what you're saying, we have a travel training program at the MWRTA that's available to anybody in the disabled community that needs it and wants to learn how to use it, how to use the public transportation system, and it's available anytime.
I spoke before on behalf of the Chamber. I'll speak now on behalf of my business. And we do transportation to get people to and from doctor's appointments, and our business philosophy is always get what you can get for free first. So even though I'm in that business, I very much support this, and I'd rather be out of that business and see people get there cheaper.
Great. Thank you. Thanks. Harold, I didn't know you were here tonight. Harold has been the driving force behind this for quite some time. Harold Rhodes, chairman of our Commission on Disability.
Representative Fernandez, my good friend Mark, Brian, my good friends from the MWRTA. I think you remember about a year and a half ago, I showed up at an MWRTA meeting and I meekly sat way in the corner and I said I was from Milford. Yeah, I was, and They said, okay, you sit back there. 2 years ago, I became chairman of the Milford Commission on Disability. And I asked one question to everyone that I could talk to. I went around and I visited all 12 of the leaders of each of the churches. I went around to all of the social services groups. I went to the Chamber of Commerce. I went to veterans. I went to everyone. And I asked them just one question. What is the number one thing, number one concern, the number one solution that Milford needs to have? 100% answer, transportation. 100%. I came back to the Board of Selectmen to ask for the permission to continue to investigate the possibility of bringing transportation. And my presentation was very short. I said, if you live in Holliston, you can take a bus to our hospital. And if you live in Attleboro, you can take a bus to our hospital. But if you live in Milford, there's no bus. There's no bus to take you to our hospital. Not a week later, Frank Saba called me up, whom you all know quite well as the former CEO of the hospital. And he said, Harold, we have a patient that needs to get to the cancer center. They need to get I'm sorry, I'm just a little tripped up. They need to get their service. What does Milford do? As the chairman of the Commission on Disability, I take calls all the time, and I suspect at one time or another I've spoken to nearly every one of the people in this room with some concern or another. I hope very much that our Board of Selectmen, that our Finance Committee, that our town meeting will all come together and bring to Milford the solution that the entire community absolutely wants and absolutely deserves to bring public transportation here to Milford. Thank you very much.
Thank you, Harold. So, how are we doing? Is there anyone else? Oh, yeah.
One other thing, we have a sign-up sheet, so if you have not signed it, can you raise your hand so I can bring it to you?
Oh.
Oh, yeah.
Goodness, are you serious? Oh, we need sign-up sheets. Yeah, so we need the sign-up sheet.
Me and my
Definitely.
sheets.
Yeah, please do.
I'm a stickler with those.
Hello, good evening. I'm Claudia Segura. I work at SMOC. I'm a legal advocate, and on behalf of the community, the immigrant community here in Milford, I am really happy for this initiative. I've been living here for about 4 years, and I work closely with immigrants from Ecuador and from Brazil. And let me tell you, this initiative will change their lives. And I'm so happy that so many people are caring about this community. I really believe that this will improve the lives of everyone here. So thank you so much.
Thank you.
Anyone else?
Oh, yeah.
This is a follow-up question from someone who's sitting next to me. We know what the fare will be. If you have to make 3 stops, let's say, in the course of 3 hours, will you have to pay the fare again and again if you're in Milford?
No, once you're on the bus, you can transfer from route to route to route at no cost.
Over time.
So in other words, you could go from Milford potentially to Woodland on the Green Line for 1 fare.
No, I'm asking you.
You get off at the hospital, an hour later you'll get back on.
I'm sorry, I did not understand that. Yes, once you're off the bus and you're using the same route going in the opposite direction, yes, it's another fare.
So theoretically, if I want to go grocery shopping and to the hospital, it'll be, I don't know, $1.50 each
Theoretically,
way
yes.
and $1.50 going back.
Theoretically,
Senior
yes.
citizen will cost you 75 cents. Not gonna happen.
Yes, if you're going in a direction and you're changing buses, keeping, quote, going forward, say inbound, it's no cost. If you go someplace on a route and then you come back on that same route, it's another payment.
So,
We have a not-for-profit organization there and a lot of members and providing service to folks in Milford. The lack of I know that the proposal on the table tonight is not for improving that service at this point, but folks wanted to say that more frequent service between Milford and Framingham would be hugely appreciated by major sectors of the community.
sure. Thank you.
Pat Merle, Milford Housing Authority. We also did a survey of our residents, and obviously we take care of any of the seniors, disabled, and low-income families in the community. Our responses was kind of interesting. 63% of our residents that responded to our survey own vehicles. However, 93% of the respondents said they would ride the bus. And they were, 80% of them were riding it between 1 and 5 days a week. And then we had another 20% that thought they might only take it 3 or 4 times a month. And our top 5 spots that they want the bus to stop were Hannaford, and then Milford Regional tied with the dollar store, and followed by the Senior Center, Big Lots, and CVS.
Sue, you're behind the dollar store. Pat, if I could, just how many units under your control of the Housing Authority?
We have 353 public housing units, and then we have an additional 300 or so rental assistance units that are in the community.
Great. Great. That's great information. Thank you.
Anyone else?
Is there anyone else that wants to?
Hi, I'm Tony Lorenz, and I'm the minister at Oakville Unitarian Parish, and I'm a resident of Milford. Been here since August, and I love Milford. And I'd just like to echo everything that I've heard said here tonight. I hope we continue to work together to make this a reality for our community. Half of our congregation over at Oakville Unitarian are residents of Milford, and I have not heard anyone say anything against making this happen. Everyone seems to be for it there, so I'm going to pass that along.
Thank you. Thank you very much.
Let's just take a few more questions.
Okay, Harold, thanks.
I'm a self-advocate, and I'm not just thinking of myself, I'm thinking of a lot of other people, just like me, would, I've used the bus a lot too.
Thank you. Thanks. Yep. Anyone else? Really appreciate everyone being here, and as Sue had indicated before, if you have not signed up on our sheets, please do so.
I know it's something that would probably be long-term, but does anyone consider the environmental aspect of having people using buses instead of the constant cars?
Well, I mean, that was one of the factors that I think led us down to start looking at this. There is the potential to reduce traffic. Maybe some people won't drive their cars, and maybe they will use the bus. I'm not going to say that that was the overriding factor, but it was certainly one that was taken into consideration. Yep, when Ed wants to get.
Yeah, I'll just comment on that. That's a good question. That's a great question. And just so you know, we have just broken ground at our Blandon Ave facility for a compressed natural gas station. And we have a plan that in the next 5 years, we're going to convert our whole fleet into compressed natural gas. So, because, you know, we think that environmentally, it's the right thing to do. So eventually there'll be no emissions from our buses anyway.
Hi, John.
Hi, my name is Jennifer Walsh. I work in Milford Public Schools. And I just want to speak on behalf of all the students that I've worked with over the years with intellectual disabilities, that this is their biggest challenge in transitioning from high school to adulthood is transportation. So I know that it's well needed and it would really benefit all of our students. Thank you.
Great. Thank you, Jen.
Just to add to that, as far as working with the older students, it seems like a black hole once these kids get out of school is 18 to 22. Nobody knows what to do with them when they get to that point. We are working very closely with the Holliston school systems to get the kids back into society and be able to go to work on their own independently. And we have got more students that are going, especially in Holliston along Route 6 in Holliston. A lot of the kids that are taking the bus live along Washington Street, Route 16, 126, and they're able to go to work at Shaw's in Ashland because they can take the bus on their own. They don't have to rely on their parents to get there. But I know exactly what you're talking to. I call it the black hole because the poor kids, once they get out of school, what do I do with my child? And I work with them too with travel training all the time. People with disabilities of any sort, whether it's blindness, I don't know if Dimitri Edwards is still here. I am working with her, with a young lady in Natick that is partially blind. She has degenerative retina. I think that's what it is. But she is riding the bus now independently by herself through the travel training program that we offer at the MWRTA. Earlier I heard from the gentleman that was from SMOC that was taking the CDL class that we offer at Metro West Regional Transit Authority, so that he'll be able to drive a bus. He's going right now for his Class C CDL license, commercial driver's license, and he'll be able to drive a small 16 passenger bus. So these are the programs that we offer at the MWRTA that is opened up to the Milford residents. Even if Milford doesn't get a fixed route, we still offer these programs to the residents because you belong to the MWRTA. And it's free of charge. To go out and get a CDL license, you're probably talking about between $4,000 and $5,000 to get it. The only cost to the person that takes the CDL program from us is you have to get your own medical ID card, and you have and a physical, and you have to go and pay for the original permit. And once you get your license, we reimburse you for that cost. So it's surprising what the MWRTA can do for you and not ask for anything in return.
Anyone else? Going once, going twice. I think the motion's been made to adjourn.